Hello, my name is Dr. Hillel Mazansky, and my website is www.gianinc.com. I specialize in medical hypnosis, guided imagery, nutrition, and exercise. Today we're going to discuss guys' embarrassing body problems and what we can do about that. Firstly, hair on the back. Some guys are happy to leave the hair on their back. Others find it an extreme embarrassment. Well, what can you do about it? You can wax the back, and that's fine, but then it's going to grow back. You can use these depilatory creams to remove the hair. Yes, that can be done, but it's going to grow back again. The only real good treatment for that is to have laser treatments of the hair follicles. The hair follicles are destroyed and no more hair on the back. The second issue is unibrow, or very thick eyebrows that grow together to the center of the face, and some guys get embarrassed by that. Well, the treatment for that is you can pluck the eyebrow, but it's going to go back. You can use again some certain creams, but it's going to grow back. The only permanent treatment for what we call unibrow is to have that lasered, and those results are reasonably very good. The third thing is rosacea. This is a red pigmentation of the skin, and the nose becomes very large and bulbous. Alcohol misuse is related to that, but not always. And the only real good treatment for that is you go to your family physician and they can prescribe an antibiotic for you, or you can go to the dermatologist, and that's easily treated. If you drink a lot of alcohol, you should decrease the amount. The next problem is hearing loss. Men don't like to lose their hearing, especially if they're dating a female and they cannot hear what they are saying. Oftentimes this is related to the type of work that they're doing and is called traumatic otalgia. Earache and deafness as a result of the trauma, which can be from loud noises at your work, or from listening to loud music constantly. The next issue is bad breath. Now, this can be very embarrassing for many people, and the problem can be one of a few things. Either there is some dental issue, and we recommend that you have a dental examination and tell your dentist that you're suffering from bad breath. The other thing can be from what you are eating. If you eat a lot of garlic or onions, that can affect the breath. We suggest that when you clean your teeth in the morning, you brush your tongue as well, and that can help. Some men use certain sprays that are available for their breath, and that is okay. But I recommend that you do have a dental checkup to make sure that there's nothing dental as a cause for bad breath. The next issue is body odor. How many men have suffered from body odor? And we all think it's due to the perspiration and sweat. It's not really. It's due to the bacteria that are in the armpit. So what we suggest is that you shower properly every day or twice a day, And you can use special deodorants or creams to stop the odor. The next thing that guys sometimes complain about is excessive sweating. Even if the temperature's cool, they sweat a great deal on their foreheads, the palms of their hands. And when you have this extreme perspiration or sweating, it tends to be related to some anxiety problem. If you're anxious or tense about something, you increase your perspiration. To control it, there's a special medication that you can get from your primary care physician that controls excess sweating, and also is the body odor. Some people have a rather pungent body odor, and what we recommend there again is to take a shower twice a day, paying particular attention to the underarm area. You can use some sort of a deodorant, and do not re-wear your workout clothes from the day before or 2 days before, because the odor from that permeates into your body. So you want to really try and avoid that. The next issue is pot belly. When guys walk around with these huge bellies, they can feel embarrassed. So-called beer belly, but the people don't always have to drink beer to have that beer belly. It is a matter of overeating. And we know we have spoken ad nauseum about the overeating. And if you want, just go on my website and have a look at the nutrition blogs and the nutrition icon for the weekly health tips. And there you will see what you should eat 5 times a day, small meals, and exercise as we have prescribed, and you will feel better. The next thing is a jock itch. That can be extremely embarrassing. It's a reddish, whitish area in around the scrotum, the testicles, and the groin. And that is a fungus infection. And really, it's very easily treated by over-the-counter antifungal creams, and you can put on the cream and you'll be fine. Following on that also is athlete's foot. Guys get embarrassed from the athlete's foot because they keep on having to scratch and their feet feel and the toes feel itchy. Well, it's a simple issue of just going to the pharmacist and buying an over-the-counter antifungal cream. You can put that on your jock itch, and you can put that on your toes. Another issue also that many guys feel embarrassed about is a receding hairline. They start getting bald a little bit, and they don't like that because baldness tends to be associated with age. And if you become more and more bald, it looks as if you're older than you really are. Now, there's not a lot that you can do to prevent the hair loss, although there are some prescription medication solution that's available that you can use. If that does not work, the treatment of choice would be a hair transplant or hair replacement, which works reasonably well. That's for the receding hairline. Another issue that guys get embarrassed about is when their prostates start enlarging, called BPH, or benign prostatic hypertrophy, in as much as they keep on having to go to the toilet. Well, here again, there's nothing natural that can prevent that, although there's some talk about certain natural products that can help BPH, but they don't really work. The only thing for that really is to go to your physician and let him prescribe, him or her, prescribe some medication that works very well for an enlarged prostate. It doesn't mean that you have cancer, but it just means that your prostate is enlarged. Then the next thing is ingrown toenails. That can be rather embarrassing for the guys in as much as the toe gets red and painful. And what we suggest to prevent ingrown toenails, if you go to the podiatrist or you go to a beautician or to a nail person, they cut it correctly. But if you do that yourself, never cut into the corners of the nail, but just cut straight across. It's the cutting into the corners that make the nail become ingrown with a red inflamed toe. Just cut straight across and you'll never have an issue of an ingrown toenail. The next one is recurrent burping. Guys get embarrassed when they're in the presence of a female or somebody else and they start burping and burping and burping. Well, burping is a normal situation in as much as that when you eat, you swallow air and the air has to come out. But if you continue to burp all the time, then there must be a reason for this, and you might have some gastrointestinal problem, especially in the stomach and what have you, whether you have reflux. You want to go and see your doctor about recurrent burping. Also, passing gas or flatulence can be extremely embarrassing, especially if it has a foul odor. Again, it's the result sometimes of the food that you eat. Foods that tend to cause gas are cauliflower, cabbage, beans, garlic, onions, that type of stuff. And if you are sensitive to passing gas, then and it's embarrassing to you, then sometimes those foods should be avoided, especially if you're going out on a date. You don't want to be causing a lot of gas or flatulence if you do that. So from head to toe, we've got more or less everything covered, from the head and the hair and the burping and the bad odor and the perspiration and the belly beer and the jock itch and the ingrown toenails. And I think I've more or less covered, and the enlarged prostate, I think I've more or less covered most of those embarrassing situations. But to solve the problem is not difficult. There are methods that you can solve those issues. It's just about taking the steps and either using something over the counter, or if that doesn't work, go and see your doctor and your dentist. And those are there is also, of course, the situation of erectile dysfunction, ED, premature ejaculation. But if you remember, we have discussed that in one of our videos, and that can also be very distressing to some guys, that when they go to make love, they're unable to get a decent erection or a sustained erection. And we did discuss the treatments for that. 99 out of 100, if there's no diabetes or heart disease or hardening of the arteries, then 99 out of 100, it is psychological. And that is where our medical hypnosis and nutrition and exercise comes in to help in that sphere. Hypnotizing all the other patients with all the other problems, that won't help. As I said, in those cases you have to use some creams, see the doctors, clean your teeth, etc., etc. My name is Dr. Hillel Mazansky, and I thank you very much for listening to our video.